Hi again. Welcome back to our fourth lecture. Our topic today now is screening for risk of falls. So screening or assessing is very important to know whether someone is at risk of falling or whether they have tendency to fall. So it is very important that all older adults age 65 and above to do fall risk screening at least once in 6 months. So today, the previous lecture, we have learned some of the uh, risk factors of falling. Okay, so what we are going to screen is actually we are trying to look for any of the risk factors that hopefully that we can prevent or we can modify the risk factors. So, we will be learning in this topic, we will look at the learning outcomes, some terminologies, the brief self-screening, fall risk test, and we will summarize the key points of this topic. So, what are the expected learning outcomes? At the end of this topic, you should be able to identify the subjective factors of falls. You should be able to identify the physical risk factors of falls. And lastly, you should be able to identify the psychological risk factors of falls. So these are some of the terminologies that you will encounter in this topic. The first one is screening. So screening is an examination or testing of individuals to separate those who are well from those who may be unwell due to some illnesses or who are at high risk for certain dangers or illnesses. Fall risk screening is an examination or testing of various risk factors to determine whether the older persons are at risk of falls. Time up and go test. This is a common test, a very practical test for older people. Uh, is also used to screen risk of falls that is practical to be used both in clinical and among those residing in the community. Okay, right. So, brief self-screening. Okay, so we can use this screening to screen whether your clients or the persons that you are looking after or anyone in the house among your families, whether they are having risk of fall. So this can be given to them and they can actually assess themselves whether they are at risk of falling. So the first questions or the first test that they need to answer, are you afraid of falling? So ask them whether they are afraid of falling. Are you afraid of falling? If they answer yes, they may be at risk of falling. Okay? Even if they don't answer yes, they answer no, yes, they may be still at risk of falling due to some non-modifiable factors such as age. If they have very advanced age, they are definitely at risk of falling. But when you ask them whether they are afraid of falling, this is something related to psychological, or sometimes they answer yes because their fear of falling. Right? So if they answered yes, then they may need to be prevented. They need to be given some intervention, and they need to do further testing that normally you go and see the physiotherapist to do some physical testings to confirm the level of risk of falling for this kind of person. Okay. Number 2, what is your level of fear of falling? So you can use this scale, okay, from 0 to 10 to rate or to assess the level of fear of falling. Okay, so 0 means no fear at all, and 10 means very afraid, so as to avoid moving. Normally they avoid moving, they don't want to move at all because of the high level of fear, and they don't want to walk or they don't want to do any physical activity for fear of falling. All right, so 1 to 3 may means that slightly afraid, 4 to 6 moderately afraid, 7 to 9 fear, and of course 10 is the maximum level of uh, fear of falling. So if the fear level of falling is 4 or above, they may be at a high risk of falling, and definitely they need some prevention and intervention. Okay, the third one. Are you sure if you move or walk, you will easily fall? If the answer yes, they may be at risk of falling because they are not confident. They are not confident, they have fear, and they think that they perceive that they are easily fall when they move or when they walk. So something need to be done for this person. Okay, so that is the 3 simple brief screening for your elderly clients or the persons that you are giving you are caring at home or anyway, or those, especially those residing in the community. But if they are they answered yes to all 3 or even 1, bring them over to see the physiotherapist for a more comprehensive testing for fear for risk of falls. Okay, the next one, we will look at 4 risk tests. Okay, this is adopted the questionnaire. Okay, number 1, have you ever had a fall in the last 12 months? If you have ever fallen in the last 12 months, your chances of falling again are high. The experience of previous falls will cause you to be very cautious, and this will cause you to reduce movement or physical activity for fear of recurring fall incidents. Fear of falling causes a variety of negative effects, where if you reduce physical activity and just sit or lie in bed alone, over time, your whole body will become weaker. Okay, so if they answer yes, they had a fall in the last 12 months, okay, they may develop fear of falling again, and even a history of fall is a risk factor for another fall. Number 2, are you taking 4 or more types of medications in a day? So older adults are highly synonymous with medication intake of more than one type due to various lifestyle related chronic diseases, and not necessarily due to the aging process. Taking more than 4 types of drugs increases the risk of falls because it is possible that taking these drugs simultaneously will cause other side effects such as dizziness, drowsiness, feeling weak, and others. If you feel this condition, you should seek advice from a doctor, especially when you have been taking such medication for too long. Okay, so if they are taking more than 4 medications, okay, so they are probably on multiple medications. They may also have the tendency to have to develop adverse effects from the intake of these multi medications, then they are actually at risk of falling. And if they know that whenever they take those medications, they feel like they have the tendency to fall, they need to see the doctor again and discuss about the medication. All right. Okay, next. Ask your client, do you feel unstable or have balance problems? If they answer yes, then may have balance problems and they may have a risk of falling. To test if you have a body instability problem, try the following activities. Okay, so you can ask them to, can you walk while talking? Can you walk while talking? It means that they are doing two tasks at one time, or with dual tasking. Alright, if they can walk while talking, if they cannot, means they probably have high risk of falling because of they cannot do multitasking or activities that challenging. Okay, so they may be at risk of falling. Try to answer questions at random while walking with someone. If you stop walking, either immediately or as soon as you start answering the questions, then you need to answer yes to question 4. Do your body sway while standing? Try standing upright with both hands close to the body and feet close together, about as wide as the shoulders. And make sure someone is watching you. If you move your arms and change the positions of your legs to control balance, then you need to answer yes to questions 4. If you answered no, then try standing with one leg raised about 1 inch off the floor. If your body is swaying to try to control body balance, then you need to answer yes to questions 4. Okay, so these questions, do you feel unstable or have balance problem in some of these in these situations? I'm so sorry because I have given you the okay, so this is the slide for the questions asking, do you feel unstable or have balance problems? Okay, uh, under these questions, there are 3 different situations where they need to answer yes or no. Okay, sorry for the technical issue. So let's continue with the 4-risk test. Now, the questions is, can you get up from a chair without using your hands for support? Can you get up from a chair without using your hands for support? Okay, so again, we have 2 situations here where they have to answer either yes or no. You should have no problem getting up from your user chair sitting without the help of hands, with the height of the chair approximately the level of your knees. So here, the answer, if they don't have risk of fall, they should answer yes. They don't have problems. In the second situation, if while trying to wake up from your feet, from your wake up, you feel unstable. Okay, I repeat. If while trying to wake up, you feel unstable, or you trying to get up, you feel unstable, dizzy, or sick, you don't feel good, you are having headache or feel faint after waking up, you may have a problem with blood pressure changes. You may be experiencing postural hypotension or orthostatic hypotension, in which a drop in blood pressure causes less blood to reach your vital organs or muscles. this will cause the risk of falling. Okay. Okay, next question is, do you limit the activities or things you normally do due to fear of falling? Okay, you answer yes or no. Okay, so if you answer yes, you reduce your activities. Okay, then that may lead to risk of falling because you may develop generalized muscle weakness and poor balance performance, then you will have tendency to fall. Okay, so let's look at the results of your test, of your fall risk test. Okay, if you answered yes to questions 1, ever fell in the last 12 months, you remember asking you about whether they had a fall the last 12 months, and you answered 2 or more in any of the subsequent questions, then most likely you are indeed at risk of falling. Okay, so what do you need to do? You need to see a doctor, as he will advise on the next steps. You may be referred to a physiotherapist who will do a more detailed physical assessment to determine whether you have physical problems such as lack of body balance due to various factors such as muscle weakness. Physiotherapists for the elderly can also advise you on various aspects such as exercise programs, uh, suitability of walking aids, and others to reduce the risk of falling. With regards to the body balance test while moving, okay, we can also do the time up and go test. This is a test that requires you to get up from sitting, then walk for 3 meters, then turn on the cone and walk back 3 meters towards the chair you were sitting on. When it arrives you need to sit. When you arrive to the chair, you need to sit down again. The time to complete one of these tests will be counted as your body balance test score or your score for balance performance. So remember the time up and go test. Okay, so this is the schematic diagram for the test. Okay, in additional to the forest test, this is more of a physical test or a very objective test that you can perform. Of course, you need someone with you when you are performing this. Normally, it is done by physiotherapists. Now, the occupational therapists also can do, even nurses can do this test, right? It is a very simple test, a very practical test, and it reflects normal functions or daily activities of older people where they have to get up from sitting, they have to walk, they have to turn back, turning and sit down again. All right. So you can try to do this test yourself following the steps below. Sit on a stable chair or lean the chair against the wall. For safety purpose, make sure someone is watching you and ask him or her to record the time it takes for you to complete the test. Next, get up from the chair while your observer starts recording the time. You can use stopwatch or watch on the wall or a cell phone watch. After getting up, start walking at a distance of 3 meters, approximately 10 feet, and turn on the marker or a cone or a cup or any marker that you can use to indicate the turning point at the end of the 3 meters. Then, after turning, walk straight towards the chair as at your normal speed. When you get to the chair, sit down again. When your back touches the chair, the observer should stop the stopwatch and then make a note at the time. Make a note of the time you completed the test. You can repeat the test about 3 times and record the best time as your score or achievement. Write it in your notebook along with the date you took the test. This test should be repeated once a month and make a comparison with the previous score. If you take more than 12 seconds to complete this test, then you need to answer yes to questions number 5. Remember the 4 risk test just now? Do you find it difficult to get up from your chair? If yes, then you probably have problems with tendency to have a fall. Okay, so we are done with a very simple screening. So we have done with a very simple screening to check. This can be considered as a pre-screening. Okay, if you notice that most of the answers indicated that there is a high chance of falling. Okay, so we need to bring the our client or the older persons to see a doctor, and the doctor may refer the elderly to see a physiotherapist for a more comprehensive testing, okay, to determine the risk of falling, and further advice on fall preventions educations, and also teaching of exercises, more home modifications to reduce the probably the environmental factors that can lead to falling. So before we end this lecture, we will try to summarize the key points that we have learned from uh, this lecture. Okay, so the first one: early detection of risk of fall is crucial and beneficial as it helps them to reduce the chances of falling, frequently experiencing functional decline, injury, or death. Number 2, risk of falls can be assessed through ways including self-answered questionnaires such as brief self-screening, FRAT, and also through physical function performance such as the time up and go test. Number 3, screening for history of falls is one of the commonest aspects to determine risk of fall, as the occurrence of fall events that might influence individuals' movement, participation in physical activities, development of fear of falls, which can lead to increment of risk of falls. Number 4, Parkinson's disease and stroke are some of the conditions that could increase the risk of falls, contributed by their symptoms itself. So people with Parkinson's disease and stroke, they may have even higher risk of falling compared to those older people who has no symptoms of these chronic illnesses. And lastly, individuals with high risk of falls is advised to do a more detailed physical assessment and be given prescriptions of exercise programs, walking aids, and others to reduce the risk of falling. Okay, so that's all. Okay, that's all for now, and I will see you again in the last topic of this course. We will be looking at the prevention strategies and some of the exercises that can be taught or performed by the elderly to prevent falls. And thank you very much.